Now I will give you the summary of deep cervical fascia. Deep cervical fascia is nothing but deep fascia of the neck. It is surrounding the neck like collar. It has been divided into 3 layers. Investing layer of deep cervical fascia, pretracheal layer and prevertebral layer. Then if you take the investing layer of deep cervical fascia first, superiorly somewhere it has to attach, inferiorly somewhere it has to attach, posteriorly somewhere it has to attach, anteriorly also somewhere it has to attach. Okay. So superior attachment, external occipital putabrans, superior nuchal line, mastoid process, external acoustic meatus, zygomatic arch, angle of the mandible, base of the mandible, symphysis mentae. Then inferior attachments, mandibular sternum, clavicle, acromion process, spinous process of scapula. Posterior attachments, external occipital putabrans, ligamentum nuchae, spinous process of C7. That means spinous process of 7th cervical vertebra. Anteriorly fuses with the similar fascia of opposite side and it also attaches to the hyoid bone. Then it is stretching from superior attachment to the inferior attachment, but it shows some special features at the parotid gland, at the submandibular gland, at the sternum, at the middle third of clavicle. First, if you take at the submandibular region or at the submandibular gland, below the submandibular gland, it will be divided into 2 layers, superficial layer and deep layer. Superficial layer attaches to the base of the mandible, deep layer attaches to the mylohyoid line. So superficial layer is covering the inferior surface of submandibular gland, deep layer is covering the medial surface of submandibular gland. Then in between the ramus of the mandible and mastoid process, just below the lower pole of the gland or apex of the parotid gland, it splits into 2 layers. This is superficial layer and this is deep layer. Superficial layer is covering the superficial surface of the parotid gland and also fuses with the epimysium of the masseter muscle and attaches to the zygomatic arch. So that this fascia, what we call parotidomasseteric fascia. Deep layer. Actually deep layer is loose and it attaches to the tympanic plate. Here it will be thickened, that means deep layer will be thickened and forms a ligament. That ligament what we call stylomandibular ligament. That will be attaching from styloid process to the angle of the mandible. That will divide the parotid gland from the submandibular gland. Then coming to the lower part, the suprasternal notch of the sternum having anterior margin and posterior margin. Just above the suprasternal notch, this investing layer of deep cervical fascia splits into anterior layer and posterior layer and attaching to the corresponding lips or corresponding margins of the suprasternal notch. That means anterior layer attaches to the anterior margin of the suprasternal notch, posterior layer attaches to the posterior margin of the suprasternal notch and forms a space here. This space what we call suprasternal space of Burns. B-U-R-N apostrophe S. Suprasternal space of Burns. Then what are the contents of suprasternal space of Burns? There will be anterior jugular venous arch, interclavicular ligament, sternal head of sternocleidomastoid and few lymph nodes. This is about the suprasternal space. Then when you see at the middle third of the clavicle, if you take the section will be like this. Inferior surface of the clavicle will be having the groove, that groove what we call subclavian groove. Within the subclavian groove, attachment of subclavius muscle. Actually subclavius muscle will be covered by clavipectoral fascia. We are least concerning about it. If you see the investing layer, when it reaches just above the clavicle, it splits into 2 layers. See here, it has been split into 2 layers, anterior layer and posterior layer. Anterior layer attaching to the anterior border of the clavicle, posterior layer attaching to the posterior border of the clavicle and forms a space in between these 2 layers. That space what we call supraclavicular space. Actually the posterior layer will be enclosing the one muscle, that muscle what we call inferior belly of omohyoid. There will be some controversies are there, we no need to go for that controversy. Just remember that posterior layer will be enclosing the inferior belly of omohyoid and forms a facial sheath. That facial sheath what we call omohyoid fascia. Then what are the contents of it? Supraclavicular nerves, then external jugular vein. This is the vertical disposition. Then if you take the transverse disposition, see here, this is the transverse disposition. In the transverse disposition, we are starting from the ligamentum nuchae. After attaching to the ligamentum nuchae, it reaches to the posterior border of the trapezius muscle and it splits and encloses the trapezius muscle at the anterior border of the trapezius muscle, again it will be fused and forming the roof for the posterior triangle. Then at the posterior border of sternocleidomastoid, again it splits and encloses the sternocleidomastoid, and at the anterior border again these two layers will be fused and forms the roof for the anterior triangle and fuses with the similar fascia of the opposite side. This is the transverse disposition, right? Then if we coming to the sum up, it is having all two features. It is covering the two muscles, trapezius, sternocleidomastoid. It is enclosing the two glands, submandibular gland and parotid gland. It is forming the two spaces, suprasternal space and supraclavicular space, and it is giving two facial processes, pre-tracheal layer, pre-vertebral layer, and it is forming the sling for two muscles, for the intermediate tendon of digastric and for the intermediate tendon of omohyoid. It is forming the roof for the posterior triangle and roof for the anterior triangle. These are all two features. You can easily remember in that way. So that is about the investing layer of deep cervical fascia. Then if we coming to the pre-tracheal layer, this pre-tracheal layer horizontal disposition if we take first, it is extending from the investing layer of deep cervical fascia underneath the sternocleidomastoid. It goes medially and it forms the anterior layer of carotid sheath. After that, it gives one facial process. That facial process will splits and encloses the gland. Which gland? Thyroid gland. Then when it reaches to the midline, fuses with the similar fascia of opposite side. Then here we have to discuss about the ligament of Berry. Ligament of Berry is nothing but it is thickening of pretracheal layer of deep cervical fascia. It connects cricoid cartilage to the thyroid gland. This ligament what we call ligament of Berry. Posterior to the ligament of Berry, you can find the recurrent laryngeal nerve. The posterior surface of the gland will be covered very loosely by pretracheal layer. Because of that, any enlargement of gland leads to backward extension, which compresses the trachea, which compresses the esophagus, which compresses the recurrent laryngeal nerve. If it compresses trachea, dyspnea. If it compresses the esophagus, dysphagia. If it compresses the recurrent laryngeal nerve, dysphonia. This is the horizontal disposition. Next, if you take the vertical disposition, vertically it is attaching to the hyoid bone, oblique line of thyroid cartilage, cricoid cartilage. Then it encircles or it encloses the thyroid gland. Then it enters into the thoracic cage through the superior inlet of thoracic cage, where it will be fuses with the Simpson's fascia or suprapleural membrane. Then it descends down into the superior mediastinum and attaches to the fibrous pericardium. That's it about the vertical disposition. So that we have completed pre-tracheal layer. Then prevertebral layer. This prevertebral layer also taking origin from the investing layer of deep cervical fascia underneath the sternocleidomastoid and goes medially and forms a posterior layer of the carotid sheath, and it covers the prevertebral muscles and also cervical vertebra, and at the midline fuses with the similar fascia of opposite side, and this will give one facial process. That facial process will be covering the scalenus anterior, scalenus medius, scalenus posterior, levator scapulae. These muscles only will forming the floor of the posterior triangle, right? So this is the roof of the posterior triangle, this is the floor of the posterior triangle. In between that one nerve also present. What is this nerve? Here, 11th cranial nerve, right? Spinal accessory nerve. Clear? Then after covering these muscles, it will be disappear underneath the trapezius muscle. Clear? So this is the horizontal disposition, right? Actually, deep to this fascia, you can find the cervical plexus and also brachial plexus. Along with that, cutaneous nerves like transverse cervical, supraclavicular, great auricular, lesser occipital. These nerves also present deep to the prevertebral layer. They pierces the prevertebral layer and they become cutaneous. Subclavian artery and axillary artery along with brachial plexus surrounded by axillary sheath. This axillary sheath is derivative of prevertebral layer of deep cervical fascia. So this is about the transverse disposition or horizontal tracing of the prevertebral layer. Then if you take the vertical disposition, if you take, it is extending from the base of the skull. That means it is attaching to the base of the skull and it will be splitting into two layers, anterior layer and posterior layer. Anterior layer fuses with the buccopharyngeal fascia. Posterior layer fuses with the anterior longitudinal ligaments of cervical vertebrae and also upper three thoracic vertebrae. In between the prevertebral layer and buccopharyngeal fascia, there is a space. That space what we call retropharyngeal space. So this is the vertical disposition. Then coming to the carotid sheath. Carotid sheath is formed by pretracheal layer and prevertebral layer. That means anterior layer is formed by pretracheal layer, posterior layer is formed by prevertebral layer, and it is extending from the base of the skull to the arch of aorta, and it is related anteriorly with the ansa cervicalis, posteriorly with the sympathetic chain. Then what are the contents of it? Common carotid artery, internal jugular vein, vagus nerve. These are the genuine contents, right? Then what are the structures which are piercing the carotid sheath? Tributaries of internal jugular vein, external carotid artery, branches of vagus nerve, 9th cranial nerve, 11th cranial nerve, 12th cranial nerve. These are the structures piercing the carotid sheath. So this is the summary of deep cervical fascia. That's it for this session.